Welcome all to this session of ISCRR's Learning Series in June. It's a chilly winter's morning from ISCRR's various offices in the Wadawurrung, the Wurundjeri and the Bunurong lands across the west, north and southern peninsulas of Victoria. My name is Dr. Kim Pham. I'm the Acting Co-Director of ISCRR, and I wish to acknowledge the traditional owners of the lands in which we work, live, and pay their respects to the elders, past, present, and emerging. I'd also like to extend this acknowledgement to the traditional owners of the lands where you work and live, so please feel free to make an acknowledgement in the chat. ISCRR is a unique partnership between Monash University and WorkSafe Victoria. And over the past 15 years, we've had the pleasure of working with world-leading researchers from around the globe in the field of workplace health and safety. And we are proud to be hosting today's session. What are the impacts of heat on workers' health and productivity? It will be presented by Andrew Ireland, who joins us here today from the Centre of Health Economics at Monash Business School. Andrew recently submitted his PhD thesis last month, and he'll be talking about findings from his research, in particular, the estimates of the effects of temperature on workplace accidents, using data from WorkSafe Victoria and the National Dataset for compensation-based statistics. He has also investigated the impact of heat thresholds on work cessation in the construction industry on workplace accidents. Congratulations, Andrew, on submitting your thesis. And I also understand that you're about to commence your postdoctoral position at the University of Illinois Urbana-Champaign later this year. Now, a couple of housekeeping for all that are attending here online today. The session will be recorded and will be available to view on the ISCRR's channels in the future. And then at the end, after Andrew's talk, there'll be an opportunity for a Q&A session. So feel free to pop your questions in the Q&A chat as we go. And now I'll hand over to Andrew.
Thanks very much, Kim, and thanks everyone for joining. I'm just going to share my screen. So just a quick acknowledgement that, as Kim mentioned, I'm using data that was supplied by WorkSafe Victoria and Safe Work Australia. So firstly, I'm grateful for being able to use that data, but also an acknowledgement that the views that I express are not necessarily those of the regulators. So I'll be talking about the impacts of heat on workers' health and productivity. And it should come as no surprise to anyone that the Earth's climate is warming, both in Australia and globally. So the chart that I've got here, which is from the Bureau of Meteorology, so it shows this dramatic increase in extreme heat events throughout the past century in Australia, with heat waves sort of increasing in intensity and severity. And globally, the past 10 years have been the hottest 10 years on record. So in response to this, there's this emerging and active literature that focuses on the health and economic impacts of climate change. And so far, it's been shown that hot weather, increases mortality, reduces agricultural output, has a negative impact on learning at schools, among other things. But less is known about the impacts of heat on the labour market, and in particular on workers' health, which is the focus of the research I'll be presenting today. So I've split the presentation into two parts. So the first part is called Heat and Worker Health, and that's about really establishing a full understanding of the relationship between temperature and occupational health, and I'll be using data from Victoria. And the second part is a look at a specific policy introduced into the construction sector where temperature stops, where work stops at a particular temperature thresholds. So this part is about maybe more of climate adaptation policy, or what we can do about it, temperature. So the first study, which is joint work with two of my supervisors at Monash, so Professor David Johnson and Dr. Rachel Knott, both in the Centre for Health Economics. This work's been published and it's available via the QR code published at the Journal of Health Economics, and it's open source. So if you're interested in further detail, you can scan the QR code. So why do we care about this topic? First, occupational health is very costly and also very common. So each year in Australia, almost 1% of workers suffer a serious accident while at work. And this has significant costs to the economy, and which has been estimated to represent around 4.1% of GDP. We also might expect that heat has an adverse effect on worker safety. First, because there's these biological limits on the human body, such that maintaining a safe body temperature becomes increasingly difficult in temperature extremes, which can lead to conditions such as dehydration and heat stroke. But also there's evidence that high temperatures can have an impact on concentration and psychomotor performance, which can be another plausible mechanism to create more accidents. And all of this is, increasingly important to understand as temperatures are, hot temperatures are occurring more often. So to do this, I'm going to be using data from Victoria, which has a mandatory workers' compensation scheme, where employers pay a premium to cover the costs of injuries and illnesses resulting at work. And this compensation covers both time away from work and medical expenses. Because it's such a large database of over 2 million claims over 35 years, I'm able to do a lot of subgroup analysis to understand which type of workers are most at risk. And importantly, the data includes the date and the postal area of the accident or the affliction, which is important in this context because it's what I use to match to the climate variables. The graph on the right shows the number of occupational health claims over time since the scheme began in 1985. And you can see that there's some volatility in the time series, but also a sort of downwards trend whereby then it sort of stabilizes throughout the past 20 or at least 10 years, where the number of claims is kind of decreasing in general. And this could be explained by many things, such as changes to the composition of the workforce, changes to the scheme, and of course, attempts to make workplaces safer. We can also see some seasonality in the time series. So in particular, January and December, which are also the hottest months, tend to have fewer accidents. But this is also, of course, when most people take leave. So bearing these time trends and seasonality in mind, we take this into account in our method. So, so we specify a model that really just looks within a particular year, a particular month. So what I do is I count the number of accidents or claims on any given day in a postal area, and you compare that with the number of accidents for other days within that month. So for example, if you take 2 days, both within December 2005 in Geelong, some of those days are going to have more accidents than others. So there's variation in the number of accidents, and there's also variation in the temperature. So some of those days are going to be hot and some of those days are not. And the way the model works is it sort of sees can that variation in temperature explain the variation in the number of claims within that month? And because these short-term fluctuations in temperature just within a single month and location are kind of random, we think this is a good sort of experiment to identify the effect of heat on or temperature on claims. The claims here is my measure of occupational health. And then we control for other things such as the day of week and precipitation. So I'll move on to the results. So first thing we do is we just look at the effect of temperature on accidents. And we see that for each additional 1 degree increase in daily maximum temperature, that results in an additional 0.24% increase in claims. And it's highly statistically significant at all conventional levels. So that would mean that a 10-degree increase in maximum temperature would result in 2.4% more claims. This is just as a linear sort of trend. We do lots in the paper to verify the robustness of this results to different model specifications. So including additional controls for air pollution or other temporal specifications, and we show that the results don't change a great deal. So our baseline effect is 0.24% increase in claims for each additional a degree of maximum temperature. So the next question is this the same across the workforce, and has this changed across time? So in this table here, I show that the effects are larger for certain types of occupations, and they've also, so if you look at the first row, this is the effects for labourers and tradespersons, and the effects here are across the whole 35 years is 0.35% per 1 degree Celsius, which is larger than other occupations at 0.12%. So we know now that some occupations are more heat sensitive, but other occupations are still affected, and this result is still significant. The next thing we're interested in is whether this effect has changed over time. So the columns are sort of the first 15 years compared to so prior to 2000 and after 2000. And if you look at just the last numbers here, you see a larger effect of 0.27 compared to 0.20 in the earlier years. So, however, when you look within occupations, the difference is not so much. So just looking within labourers and tradespersons, it's only gone from 0.36 to 0.34. So it's roughly stable within occupations. So what I take from this is I attribute that reduction in the heat effect is really just driven by changes in the composition of the labour force. And within occupations, I don't think there's really been any reduction in the effect over time. So the two takeaways here are that labourers and tradespersons are more affected, and this effect hasn't really reduced over time within occupations. And I look at this further on the next slide. Here I'm just looking at these high-risk workers of labourers and tradespersons, and I've split the sample up into 5-year periods. And we can see that the effect is roughly similar. Well, heat has been important throughout the whole analysis period, whole 35-year period. And in fact, the largest effect is for the most recent year grouping. So I don't think there's really any evidence that the effect has reduced over time within high-risk workers. So up until this point, I've just shown you results based on assuming that there's this linear, the shape of the relationship between temperature and workplace accidents is linear, but there's no reason to necessarily expect that that's the case. So what I do here is I've split the, I use different bins for maximum temperature to get a sense of any non-linearities in the effect. And a few things stand out here. So first, the shape of the relationship is indeed approximately linear. So increases in temperatures increase workplace accidents. And this aligns with some evidence from the US. There's a study from California and Texas, which show a very sort of similar kind of linear pattern. So it might be the case that at colder temperatures, colder than we observe in Australia, there might be some sort of increase in risk, but it's not observed in our data set. The next thing is that we get the largest effect for days between 33 and 36 degrees, whereby a day that's in that range has an additional 6.2% increase in accidents compared to a day in the reference category of 18 to 21 degrees. And then the last thing I'll point out is we got an increase in claims on days above 36, so in our highest temperature bin, but it's a less of an effect than the days slightly less. And I'll talk more about this when I talk about heat thresholds, but for now I'll just sort of say that all of these results I think should be interpreted as the residual risk remaining after accounting for any kind of adaptation measures. So if people take the day off on really hot days, or other sort of policies in place like mandatory rest breaks or water, that these results are sort of net of those effects. So some of those things might be reducing the risk on these really hot days. The database also has a lot of information to classify the types of claims, and that now allows me to estimate effects separately for various accident types. And a few things stand out here, some of which I'd say are expected, and some of them are maybe things I hadn't thought about that are quite interesting. So if you look at accident type, we get a very large effect for these ones that are specifically coded as heat related. So these will be things like dehydration and heat stroke. So it's sort of expected that you'll get a major increase in this type of accidents on hot days. And indeed, we do see that. However, this only represents a small portion of the heat-related accidents, because we also see a stark increase in a range of accident types. So things such as burns, wounds, and lacerations. So burns might be related to touching hot surfaces or fires that are just more common. Firefighters working in bushfires and these kind of things. So I think that when we think of heat-related accidents, it's really not just around dehydration and heat stress, but also heat directly creates a more unsafe environment. And so managing the environment as well as the physiological needs of workers is something that I think is really an important takeaway from this study. There's also sort of things like hitting objects and wounds and lacerations that might sort of be alluding to more like that kind of reduced concentration or performance as a possible mechanism. Although I don't directly observe that in the study, I think that these results are suggestive of that. So thinking a little bit more about the environment, I estimate the effects separately by industry, and in the paper I've got the full list of industries, but I've just got a truncated version of the table here showing 2 industries with very large effects: agriculture and construction. And I think part of the reason for these larger effects are that they spend a greater proportion of time outdoors, which might be sort of expected. but also these categories of labourers and tradespersons are fairly broad, and maybe looking at sort of further details down that the types of sub sort of occupation codes might be different compositions. So some labourers and tradespersons in the health industry might be more likely to be working as or education industry working as cleaners or maintenance, might be more likely to work inside, whereas in construction they might be more likely to be handling heavy machinery. So the last sort of part of the results for this section is going to be focusing on which type of workers are most at risk. So previous studies have sort of reported that males are most at risk to heat-related accidents, and indeed, when you just look at the overall effect, it is larger for males. However, when you look within when you sort of control for the type of work that by looking within labourers and tradespersons in these high-risk industries, it's no longer the case. So, and in fact, we get a larger estimate for females. So I don't think that gender should be considered as sort of an independent risk factor. Sort of similarly, older workers have been previously reported as most at risk. So when you look overall, we get larger effects for younger and older workers, although there might be different activities done by different age groups. Looking within just the high-risk workers, we get largest effects for older workers. So older workers may be particularly at risk. Looking within different sort of earnings or income gradients based on the pre-claim earnings, we find that middle income workers have the largest effect overall, but for workers in these high-risk jobs, high income workers are the most impacted. So this could be pointing towards something to do with like kind of a hazard pay, which is where workers in high risk settings might be compensated for the additional risk. And this is different to results from the United States, where they found lower income workers most affected. And then finally, when we look at the firm size to get a sense of whether management maybe can mitigate some of the effects, we find that it's the small and medium workplaces that have the larger heat effects, and the large work sites have a lesser heat effect, both overall and within the high risk settings. So just to sum up the conclusions for this part, and then I'll move on to the second part. We've seen that heat remains a significant threat throughout 35 years in Victoria. We get particularly large effects for labourers and tradespersons in agriculture and construction. And this is because they might have fewer options to adapt to heat, such as working from home or air conditioning. We don't find that low-income workers are at greater risk. And similarly, although males bear the majority of the heat-related injury burden, you shouldn't consider gender to be an independent risk factor. So when compared to peers, males are not at greater risk. Heat increases various types of accidents, which affect virtually all parts of the body. And we think that reduced concentration could be an important mechanism. And that also heat policy should be addressing the environmental hazards, such as volatile chemicals, hot surfaces, fire, as well as the workers' physiological needs. So I'll move on to the second study now, which is looking specifically at the effect of heat thresholds on construction workers' health. This work is still somewhat in progress, so I do welcome questions and comments at the end. So we know that, now we know that working in heat can be dangerous, but what I sort of haven't mentioned is that there's also evidence that it can also be less productive. And because of that, you've got this situation where working on really hot days, if they're both less productive and more dangerous, could be kind of not very sensible. And also these outdoor workers in physically demanding jobs who are most at risk don't often have other options for to adapt. So I'm looking at, can temperature thresholds for work cessation improve workers' safety? This is a question I'm interested here. So the blue dots essentially are the main results from the paper we just saw, and where you sort of get this linear effect across increasing accidents with temperature. And I've just compared this with results from similar studies in Texas and California, where and for much of the distribution, it follows a similar sort of pattern, this kind of linear pattern, except they don't have this decrease for the hottest bin that I mentioned before. So in Texas, where there's virtually no heat-related protections for workers, it just continues to rise, this risk. And in California, only once it gets above, I think it's about 105 degrees Fahrenheit, 40, so really hot days, there's a marginal reduction, and that's maybe due to some heat policies they have at a much higher level. Whereas in Victoria, we have rules for workers to stop working at various temperatures. So I'm wondering whether, so this is kind of motivating this question of whether these thresholds are part of this to explain this difference. So to understand the rules, I'm just sort of graphically showing the way collective bargaining works in Australia. So at the national level, all workers are covered by things such as the Fair Work Act and legislation. And then certain industries can sort of improve on those standards through industrial awards. And then specific employers or firms can improve again on those standards by agreeing things through an EBA or enterprise bargaining agreement. And then you have your individual employment contract. So for example, in terms of pay at the national level, there's the minimum wage, but then your individual employment contract can be higher than the minimum wage. In terms of heat-related safety, all employers are required to take reasonable precautions to maintain safe working environments under various state and territory laws. In the construction sector, the Building and Construction On-Site Award mentions procedures for inclement weather, but it doesn't specify exactly what that means in terms of a specific temperature. So it's really at this firm level that specific employers can have an agreement whereby at various temperatures, work stops, and detail the sort of process for that. The way that works, I guess. And because these EBAs are often negotiated by unions, so often employees are represented by unions, and unions have different branches for each state. There's variation between states and in how these rules operate. And so I'm going to exploit this variation for a particular case study. I'm going to be looking at the case where Victoria's had these heat threshold rules for a very long time. So the Victorian branch of the CFMEU has included all heat thresholds in all of their agreements since at least 2005, whereas the New South Wales branch only introduced a similar policy in late 2013, which is useful because it allows me to make a comparison to understand the effects of this policy. And in both states, work stops when temperatures reach 35 degrees. So the data is essentially the similar thing, but to what I used in the previous study, but it's the national dataset. So I'm going to be using the occupational health claims from both Victoria and New South Wales, and the model is essentially the same as what I had before. And what you see is here I'm looking at the impact of temperature on occupational health claims in New South Wales for construction workers. And this is in the period where they don't have the heat rules. So you see that once temperatures get very hot, you get a really large increase. So for days above 39 degrees, there's a 30% increase in claims. And even days between 35 and 39 degrees, there's about a 15% increase in claims. And then if you compare that for the period just after they implemented the heat rules, it's quite a different story. So those hot days now have a reduction in claims compared to the reference group, and the days just above the thresholds have virtually no increase in claims. And this compares closely with Victoria. So Victoria, who's had the rules throughout the whole period, looks much more like New South Wales in the after period, where when they've introduced the rules. So this is sort of visual evidence that really the one that stands out is this pre-period for New South Wales where they didn't have the rules. I then formalized this in a model, and you sort of see that exactly kind of what you expect. So from the visual evidence that this 32 point, so it's about 33, the policy leads to about a 33% reduction or percentage point reduction, which is slightly more than the heat effect. And that's the same whether you identify that through both state or time variation, as you could see from the graphs. And then this is just my last slide now. I'm just gonna, I run this through different subgroups of the construction industry, and for all the different subgroups you see, the blue is the temperature effects, and so temperature affects all of these subgroups, and then the policy effects sort of reduces. So I see this as kind of good compliance with the rules, and it's a way of reducing the effect, and it's been successful across all parts of the construction sector. So I take this as evidence that heat thresholds can be an effective way to reduce accidents. So even though all employees are required to maintain a safe work environment, and heat is a known risk, having this specific threshold is important. However, there's still more to do, and I think further analysis is required to understand the impact of the policy on productivity and output. So is this time relocated to safer and more productive days? And, we know that accidents can result in significant times off work. So, is the saved accidents and the time off work from that greater or less than the time off work from the policy itself? So that's sort of my last results slide, and I'm happy to sort of end now and take any questions.
Thanks, Andrew, for sharing your knowledge. It's a very interesting two-part story, first on the relationship between temperature and occupational health, but also that understanding of that relationship and its application in the context of the construction sector and claims and accidents. Yes, we will now move on to the Q&A session. If you have a question for Andrew, can you please post it in the Q&A chat, and then we will endeavour to answer each one. All right, I will look through the chat. Oh, we have one general question. The first one is, Andrew, are you able to comment, given that you're from the Centre for Health Economics, I've got a cost-related question. Are you able to comment on the cost of heat-related workplace accidents?
Yeah, so in the paper, we actually do a back of the envelope type calculation to get a bit of a sense of the cost. So I opened sort of by saying that occupational health is very costly. So Safe Work Australia have done some sort of estimates around the cost of workplace accidents. And I use some of their figures as part of my calculation to understand the cost of heat-related accidents. And in particular, what I do is I look at the warming that has occurred just in the last 35 years. So since the scheme began in 1985, you know, there's a distribution of temperature that you would normally expect for each postcode. So you'd expect some hot days and some cold days. And then I take the distribution we get now, and I use the difference between that with my temperature bins to work out how many additional accidents you'd get, and then multiply that by the cost of each accident. And when you do that, it comes out that around that, just the warming that's occurred since the 1980s is responsible for additional cost of around $40 million in Victoria each year. And I guess the other comment I'd say is that because we've got just this linear shape and we don't really see like a U shape in the relationship, it kind of means that any warming that occurs is just bad. So it just sort of increases accidents and therefore increases cost. So it's somewhere in just the warming alone from the last 35 years is around $40 million a year. And that will likely increase.
Wow, heat is dangerous. You're less productive, and it costs, and it has costs to the economy. Thank you.
And that's not including, I guess, the kind of productivity type costs as well, which is I guess difficult to do.
Yeah, thank you. Do you have a recommended specific temperature threshold at which work should cease? Should it be different to the 35 degrees?
That's a really good question. So to give some context, there is, I guess, variation between the states. So and you know, so in WA it's 37.5, in I think ACT and South Australia it's about 37, 35 in New South Wales and Victoria. And in Queensland they've also got rules for humidity as well. So I guess it's a different climate. So it's a difficult question. I think the way that it's worked at the moment has been essentially a bargaining process about, and it sort of seems to relate more to, I guess, what can be negotiated for. So like if the days occur more frequently, like such as they do in Western Australia, you kind of end up with a higher threshold. And to me, you know, this doesn't necessarily make sense. Like just because humidity occurs more in Queensland than it does in Victoria doesn't necessarily mean that those conditions are any more safe when they do occur in Victoria. So for example, you know, there's this 28 degrees with 75% humidity is the rule in Queensland. That hardly ever occurs in Victoria, but it does occur, you know, maybe once every 3 years or so. And there's no reason to think that, if anything, we'd be less acclimatized to those conditions. So to answer your question, I don't necessarily know the number, but I think the way it's done seems to be more about, you know, through a bargaining type process than really thinking about what is the risk. And I think it's something I should, you know, kind of, you know, look more into kind of giving that recommendation and, you know, seeing what I can do. So it's a very helpful question. Yeah, thanks.
Thanks, Andrew. Another question. Uh, and did you find any variation in the age of workers with heat-related injuries?
Yeah, so I did have that in, I sort of went through it quite quickly though, and I sort of showed that so there wasn't, so I think when you look at just all workers overall, it was both younger and older workers had larger heat effects. But when you look at just within the kind of high risk group of workers, there's a slightly larger effect for older workers. I don't think it sort of comes out as, you know, statistically a difference between, so it's hard to necessarily say, but it's at least suggestive that maybe older workers are more at risk, but then it's complicated as well because I don't necessarily observe the type of activities done by different age groups. So I would say weak sort of suggestive evidence that maybe older workers are more at risk.
Yeah. Now, did you see any difference in results based on a single day, like a single hot day versus multiple hot days? For example, you know, a cumulative effect from a heat wave.
Yeah, that's interesting. Yeah, so there's kind of potential for like a dynamic type effect. So we've thought a bit about this, and there's some results in the paper on this as well. So in particular, looking at, you know, the effect of yesterday's temperature or overnight minimum temperatures to see whether there's kind of a lagged effect as well. So, you know, being more tired from the day before might then increase the number of accidents. And so what we find through those models is the majority of the effect is a same day effect, but there is also yesterday's temperature also does, so a high yesterday's temperature also does increase accidents today. However, overnight temperatures don't seem to matter at all. So we thought maybe the higher temperatures overnight might sort of lead to poorer quality sleep, but that just doesn't seem to result in more accidents for whatever reason.
Wow, we have lots of questions. Keep them coming. And did your investigation, Andrew, have any conclusions about cold weather on worker health impacts? Or do you think that might be a future research area that might be interesting to pursue?
Yeah, I mean, so we do sort of look throughout that distribution of temperatures that we experience in Victoria, and you know, like I sort of said, like in the colder temperatures don't increase accidents. However, and that does align with the results from California and Texas, which have, I guess, broadly similar climates. What I will say though is there is some evidence from Europe. So there's a study in using Italian data, and which does probably experience more of those, especially in kind of Alpine region, Alps, and that where they sort of, you know, more of those, I guess, snowy type conditions. And they do see a little bit more of a U shape at those colder temperatures. And they, in their paper, they kind of find that in particular, it's the commuting accidents that increase in those colder temperatures. So I guess my view would be that for when it's cold is probably doesn't matter too much until you get very cold, and then it might matter for these kind of icy type conditions and slips and that kind of thing. Yeah, I mean, there might be other types of things like, you know, neuropathic pain and that might be increased in cold weather, but we didn't observe it at the temperatures that we experience in Victoria, at least.
That's interesting. You're talking about extreme cold, so I suppose maybe on that vein, you know, could you comment in on the considerations of your research, you know, between climate and occupational sectors where there are other extreme heat events? You know, I'm thinking, say, the occupational risk to, say, first responders that might have to respond to a climate event like a bushfire, where you don't necessarily have the luxury of stopping work at 35 degrees. Yes, can you comment on any considerations in that respect?
Yeah, I think that's a particularly interesting group because I guess exactly as you said, you don't have that kind of ability to sort of stop work So I sort of mentioned the construction workers are a group where you can't have sort of work from home or air conditioning in all settings, but at least they can kind of stop. Whereas you sort of, yeah, there are workers where there is just no option.
Mm.
I guess some things that might be available as I guess making sure you where possible have the ability to self-pace or have access to water. But even things like that could be interesting to look at is things like protective equipment. It can reduce risks in many settings, but also can increase the risk of overheating as well. So I think that can be kind of an interesting aspect to it. Do we have the right protective equipment and clothing on all settings? It's a difficult one, I think, but it's something I think to look at, and I think it's particularly pressing in the context of climate change.
Yes. All right. I think we have one final question. Now, given a lot of the attendees here today are regulators, either in Victoria or other states, Andrew. So, there's a lot here that are thinking about how do we influence policy and workers' conditions. So, what question would you give advice to these policymakers that are here or regulators that are here today? What questions should they ask themselves on the basis of this talk that you've given on climate?
Yeah, I guess the thing that I sort of said it a bit before, but I guess the heat advice around managing the risk of heat stroke and dehydration is of course really important, and it's very valuable. But I think also considering how we manage risks around managing the environment itself. So I saw that increase in accidents related to chemicals, and so I think there is, I guess, guidance already on how to manage these risks, but I think they're particularly maybe increasing awareness to those is particularly relevant. Because it's both the risks to the body and to the environment that I think create these additional accidents.
Mm. All right. Thank you, Andrew.
Thanks very much for having me.
That was a really, I think it's triggered a lot of questions and a lot of interest. So again, thank you again, Andrew, for presenting such an interesting talk. And to all those here, just to let you know that a copy of this presentation will be available to view on ISCRR's website in the coming week. As you know, we're all about continuous improvement, so an evaluation pop-up will appear shortly. Please share your feedback, and also if you're interested in attending future sessions of ISCRR's webinars. We'll continue to run a range of webinars like this one on various topics. So if you have a topic of interest that you'd like ISCRR to cover, please contact us on info@isccr.com.au. Thank you again, Andrew, and thank you again all for joining us. Have a lovely day.